Hey, welcome back. Thanks for subscribing. If you haven't seen the cold video yet, then go see the cold video, because I'm doing a cold video and a flu video, colds and flu. Because it's winter time and because it's flu season, I've been seeing quite a few people in the office who have come in with the flu, and I wanted to let you know how to differentiate the flu from a cold. So much of the time when people have the flu, they feel and look like a truck just ran over them. Not actual like squashed, bloody, and bleeding, but they just sit there like it's almost difficult to keep their eyes open. And so I can walk in the room and see that somebody's got certain symptoms on the little thing that my nurse writes for me, and I'll look at the patient and I'll go, wow, looks like the flu. But what happens is the flu is a full body experience. You feel like sleeping. You don't feel like sitting up. You feel like laying down. You feel so tired that you want to sleep for days. Sometimes you have a fever. Often you have a fever. And sometimes the typical flu symptoms would be fever, body aches, headache. And when I say body aches, I mean like muscle aches, like it feels like everything hurts. That will often come along with runny nose, sore throat, and a cough. And some years the flu will go down into the chest within a day or two, and you can get a flu pneumonia, which causes a pretty bad cough, and then sometimes wheezing and shortness of breath. So it's a totally different animal than the cold. The cold, you can limp through your day. You know, you're annoyed enough that you can complain about it, but when you have the flu, you're just flat out. You know, you don't even want to come into the doctor. You just want to stay in bed. Now, within the first 48 hours of flu symptoms, when they start, there are some medicines that we can use to treat that, but between 48 and 72 hours that window closes. So if you do think that you've got the flu, then I would say either try and communicate with your doctor and see if you should come in, if they can see you, or if you know definitely that you've had contact with somebody with the flu. Like you said, my sister had the flu and she visited me this weekend, and now I have the same symptoms. Then sometimes you can get a prescription, but it depends on the doctor, and because their malpractice insurance is on the line, don't ask them to do weird stuff. Okay, so that's just a personal aside. As a physician, Kim is raising her eyebrows at me. Let's talk about the flu again. Okay, so the flu normally will last. It's normally bad for about 5 days when it's bad. The medications can shorten that. But sometimes the flu will last for 5 to 10 days, depending on how well you were before you caught the flu. And after the flu, then you can have, sometimes what can happen is you can develop a secondary infection. And I see this pretty commonly, like people will get the flu, and if it drops down into the chest and they're having a lot of mucus, then that mucus can get secondarily infected. And what that's called is either bronchitis or a pneumonia. So if you're coughing up chunky colored stuff, if you're having wheezing or rumbling in your chest, if you're not feeling like you can breathe very well, or if you're actually having shortness of breath, then you need to go be seen. If you're having chest pain, you need to go into the hospital, because this season I've actually seen people who've had heart trouble before get the flu and go into heart failure. So this is nothing to mess around with. If you feel like this is really unusual and I'm really feeling poorly, the things that would send you to the hospital, that's Maverick the dog, the things that would send you to the hospital would be high fever, unable to keep down food, because vomiting, nausea, and diarrhea can happen with the flu too. So if you can't keep down fluids and you're dehydrated, hospital. Chest pain, hospital. Can't breathe, hospital. Okay? So these things are very serious. And if it's nothing, then they'll send you home from the emergency room or from the urgent care with something that will help you. And if you're bad enough, then sometimes they'll admit you to the hospital. So that's why I like to treat flu and cold in different videos, because the flu is the serious one. The flu is the thing that can really be damaging to you. And it shows up different in different people. Like a little kid would just act like they're just not acting the same, Sometimes older people don't have all of those symptoms. Sometimes older people don't have a high fever, but if you've got an older person who's been like grandma that lives in your house, and you watch her, and she's not totally healthy, but she does pretty good, and all of a sudden she won't get out of bed, have her see the doctor. So those are some warning signs with the flu, and that's a little bit more information about the flu so that you know what to do and where to go with it. And I certainly hope you don't catch it, but if you do, there's your information. See ya.